One of my kids' favorite book series when they were little was about a little boy frog named Froggy. One of the stories in the series is called Froggy's Baby Sister. It is really cute, fun, and sometimes it's hilarious. In the story, Froggy's mom is taken to the hospital in a taxi cab along with his dad, and a day or two later, one baby sister is brought home wrapped in a blanket. Froggy's baby sister drinks pureed flies from a bottle. Of course, the story is about the adjustment of an older brother to a new baby sister. It's also a story about a frog with a baby sister who drinks from a bottle. And so I have a good laugh with my kids. So the combination of biology and fiction in a story is really fun to read about with small people. So this story is just one example of the cultural model, which is that mom gets taken away to the hospital and has a baby and brings the baby home. You don't really hear a lot about what's going on at the hospital. Also, it normalizes baby drinking from a bottle. And the story of the birth of baby frogs gets really weird. In my work as a midwife, I have heard every reaction you can imagine when I share that I support women who want to give birth at home. Most of the initial questions have to do with risk and safety, and sometimes legality. Is that allowed? Is that safe? Is that legal? Is that risky? Isn't that unsafe? You're brave. So today, join me for a brief exploration into our ideas about risk and safety around birth. My goal is to challenge one or more of your unspoken assumptions. So the first point I would like to discuss is who decides what is safe? Who decides what is risky? In discussions around healthcare, news outlets often call in an expert witness or someone who they perceive as knowledgeable about childbirth or maternal health care. In this case, an OBGYN. Sometimes they even call in a representative from an organization of OBGYNs or other kind of doctors, such as ACOG. But in decisions about your own health care, you are the expert, not an organization and not even your doctor. If you choose to decline a test or make a decision that's different from the cultural expectation, you are likely to get questions about the safety of your choice or whether you can even make that choice. So you must remember the most important voice when it comes to your healthcare is your voice, and you get to decide what safe means to you. So what does safe mean? So that's a complicated discussion. First of all, we live with risk every day. We drive our car to the grocery store. Our kids take the school bus to school. We walk down the street. We go out in public. All of these decisions that we make have risk. What's complicated is that the perception of risk is skewed by what society thinks is normal. So for example, it's normal to get in your car and drive it to work or drive your kids to school. And so most people don't have anxiety about driving except in high traffic situations. A great many more people have anxiety about flying. But if you actually compare the statistics between flying and automobile travel, the statistics show that it's actually safer to take an airplane. So when it comes to where and how and with whom to give birth, the question should be which risks and benefits are acceptable to you, not society. This is your decision. It is important to look at the risks and benefits of all the choices available to you. For example, birthing at home with a midwife has a much lower risk of intervention, such as an induced labor or a cesarean section, but it has a longer transport time if, for example, the baby needs some medical help. While birthing in a hospital with a midwife or OB has an immediate response in the case of an emergency, there's also increased risk of aggressive infection for both the mom and the baby. Different people are going to listen to risks and benefits, and they're going to come to different conclusions because we're all individual and we value certain risks and certain benefits differently. That doesn't mean that your outcome is wrong because it's different from someone else's. So let's spend a few minutes talking about how safety and risk are verified or analyzed. So research, or by the numbers or via statistics, is one way that we can analyze safety and risk. This is useful for someone who may use the numerical assessment of risk of complications in making their decisions. On the other hand, other people feel like, oh, I'm just a statistic, I don't want to be a number, and so they don't find the statistics or the research to be meaningful to them. Interestingly, the statistics method is used most often by healthcare professionals and by scientists. So another way people assess for risk or make decisions about risk is just based on tradition. I gave birth with this doctor before, so they feel comfortable because of familiarity and tradition. A third way is common sense. I am built to give birth, therefore it should be straightforward. This contingent is usually strongly in the biology camp. Either I am designed or evolved by nature, or fearfully and wonderfully made. Either way, there is a lot of trust in the process of labor and birth because of design or biology. A fourth way people define safety is by their gut. What I'm referring to is like your gut instinct or intuition. Probably people who feel like God told them to do it that way, or they feel inspired by the Spirit, would fall into this category. Basically, they make a decision, but there's no logical reason that other people can understand that they make the decision. So they're relying on an internal feeling, a gut feeling. Gut instinct is a really strong motivator for why people might define something as feeling safe or not safe. The last point of this discussion is what should you do for your birth and your health care? This decision can't be made by anyone else. The best answer is the safest place for you to give birth is where you feel safest. And let's break that down. So physiologic birth works best when the birthing person or woman feels secure, safe, and uninhibited. So secure means that all the stress hormones are suppressed. She feels relaxed and loved and totally in her element. Uninhibited means she doesn't have any shyness or shame about how she's behaving, whether it's making a loud noise or just desiring to take all her clothes off, because a lot of women do that in labor, but many don't too. Feeling safe means that she feels supported by the people she has invited to the birth, including doctors, midwives, doulas, family members, the people who are present. So these are the three elements that really support physiologic birth the best. For many women, the hospital produces a really stressful response. There are lots of beeps, loud noises, bright lights. In fact, one expert has said that the best environment for birthing in is the same environment that the baby was conceived in. For many other women, the hospital has a sense of safety and security because maybe they were helped at a time they needed help in a hospital, or a loved one's life was saved, or a cultural expectation. So a major tool that can be accessed to reduce risk around childbirth in any setting is a really good childbirth education class. This is where you can learn about what all those hormones do in labor, the natural flow of labor and birth, and also many tools for being a good decision maker for your healthcare and your children's healthcare throughout your lives. So I can't be the one to make the decision about where is safest for you to give birth. That has to be your decision. It can't be where is safest for your mom or your sister or your friend. It has to be your decision. Of course, your real reason for listening to this video all the way through is you're wondering, why was a home birth midwife reading Froggy's baby sister to her kids? Because Froggy is hilarious. And we followed the discussion through to its logical conclusion about labor and birth and frogs. And oh, by the way, just wait until you hear how I rewrote the story of Jemima Puddle Duck. So keep your eye on Midwife Becky's Homebirth channel for good, reliable information about all things birth. I am trying to post every week on Thursday or Friday, so keep your eyes open. Thanks for stopping by.